That's it. All right, if y'all, let me call this legislative public hearing on block grants to order. We apologize for the delay with the interpreter and with us figuring out the speaker system. Let me introduce myself. I'm Tim Golden. I represent District 8 in the State Senate. Sitting on the podium with me is Representative Katie Dempsey to my left and Sarah Dunn representing the House Budget Office, and Clay Buckaloo to my left representing the Senate Budget and Valuation Office. Demetrius Taylor is Budget Director for the Department of Human Services, and Lee Wright is the Director of Budget and Finance for the Department of Behavioral Health and Developmental Disabilities. Before we get started, is there anyone who requires sign language interpreter services? If so, please identify yourself where the interpreter can position himself. Thank you for attending this block grant hearing today. The purpose of the hearing is to receive public comments on the use of 5 human service block grants that Georgia receives from the federal government. The hearing also provides the members of the legislature the opportunity to listen to views of private citizens and other interested parties on how the block grants should be used for the state fiscal year 2014 budget, which begins on July 1st of 2013. These block grants are community mental health block grants, community service block grants, low-income home energy assistance block grants, social service block grants, and substance abuse prevention and treatment block grants. Public input is an important aspect of the deliberative process that the legislature undertakes in making decisions about our state budget. I appreciate you taking the time to participate in this process. And at this time, we're going to recognize Demetrius Taylor, who will provide a brief summary of the grants and explain how we will proceed. If you would, please welcome Mr. Taylor.
Thank you, Senator Tim Golden. As Senator Tim Golden has told you, the Department of Human Services will receive public comments on 3 federal block grants today. By federal law, Georgia is required to hold these public hearings today. These grants. These grants are the Community Services Block Grant, Low Income Home Energy Assistance Block Grant, and the Social Services Block Grant. At this time, I will give you a brief overview of these 3 grants. The Community Services Block Grant provides funds for services and activities that impact the causes of poverty and to assist low-income participants. These funds are distributed to local agencies throughout the state and fund a wide range of services, including employment, education, meals and nutrition services, and home services. The Low-Income Home Energy Assistance Block Grant provides cash assistance to qualified low-income households for home energy costs, weatherization costs such as insulation, caulking, and weather stripping to reduce energy consumption and for energy crisis intervention. Finally, the Social Services Block Grant funds various services such as daycare services for children, adults and persons with mental retardation, home delivered meals, homemaker services, transportation, and protective services for adults and children. This grant also assists families to achieve and or maintain self-support and self-sufficiency. At this time, I'll call Lee Wright, the Department of Behavioral Health and Developmental Disabilities, Director of Budget and Finance, will provide a list and a brief summary of his agency grants.
Thank you, Marshall. The Department of Behavioral Health and Developmental Disabilities will receive public comments on 2 federal block grants today. These 2 grants are the Community Mental Health Services Block Grant and the Substance Abuse Prevention and Treatment Block Grant. Here's a brief overview of each of these grants. First, the Community Mental Health Services Block Grant implements the provisions of the Mental Health State Plan by providing services to individuals with a serious mental illness and to children with a serious emotional disturbance. The second grant, the Substance Abuse Prevention and Treatment Block Grant, provides funds for community-based alcohol and drug treatment, prevention, and early intervention programs. Thank you. Now I'll turn it back over to Marshall to continue.
More details about each of these grants, including types of programs that can be funded and their proposed funding levels, are included in the color-coded pamphlets that are available on the table. There's a separate pamphlet on each grant. Before receiving your comments, let me go over a few ground rules. We will take speakers in the order in which they sign up to speak. If you have not signed up yet, you may do so outside at the table. Please give us your name of the organization you represent. If there are more than one representative here from the same organization, please choose one to speak in reference to your organization. By doing this, we will ensure that each organization and citizen gets a fair chance to comment. You will be given 5 minutes in which to present your comments. There is a timekeeper who will let you know when you have 1 minute left. I will initially call 2 speakers to the podium at a time. As the first person is speaking, the next speaker should be making his or her way to the podium. Then as I call your name, please make your way to the podium. If you have written comments for the record or a copy of your speech, please place these on the table at the end of the meeting. Now let's begin. First up is Ann Williams from GCOA, and then next up is Nancy Petra.
Okay, I'm Ann Williams, Legislative Chair for the Georgia Council on Aging and an advocate for Georgia's seniors. The Council, in its advisory capacity to state government, wishes to address the allocation of social services block grant funding for seniors. SSBG monies are allocated to local communities through contracts with the Department of Human Services, the Division of Aging Services, to provide services that enable older Georgians to continue living at home in their communities, often delaying or completely preventing nursing home placement. SSBG monies also help to ensure that Georgia's most vulnerable adults are protected through Adult Protective Services and the Long-Term Care Ombudsman Program. Both of those work to improve the lives of residents of long-term care facilities. In recent years, SSBG has supported the Money Follows the Person program, paying for expenses like clothing and furniture for persons coming out of institutional settings back into the community. The Aging Network utilizes SSBG funding to provide home-delivered meals, homemaker services, adult daycare, respite care, and transportation. These programs support the individual at home, improve quality of life, and reduce the burden and high costs of nursing home placement on the family and the state. These services cost, on average, $1,800 annually, while nursing home placement costs over $30,000 to Medicaid annually. This network of services encourages those who voluntarily care for an elderly family and friends, providing them with resources rather than supplanting their valiant efforts. Georgia's population of adults over 55 years of age grew by 45% in the past 10 years, compared to overall population growth of only 18% and growth of 15% for children under 19 years of age. However, the share of SSBG funding allocated for aging services has remained unchanged. Georgia continues to allocate a small percentage of SSBG funding to aging services, while Georgia's older population is growing at a faster pace than most other states. It's our hope that you will review the data on these shifting demographics and take action as legislators to enhance funding for services for older adults and their caregivers, rather than leaving the allocation to the department, which has not responded to the changing population. We again ask that you consider increasing that allocation to better reflect the growth in the older population. The council is often alone in giving testimony at this hearing, and we have asked for this consideration for a number of years. In the meantime, the population and the need continues to grow. And again, we're asking you, and we thank you for the opportunity to testify before you. Thank you.
I can get this up, I'm a little taller. Good afternoon. My name is Nancy Petra. I am the coordinator of the Senior Citizens Advocacy Project. This is a collaboration of the Georgia Gerontology Society, the Georgia Council on Aging, and the Georgia Area Agencies on Aging. As you've already heard from Ann Williams from the council, the population of older adults in Georgia has grown rapidly. And I know you heard a little bit of this morning in your budget hearing too from Commissioner Reese. But services for Georgians are, access to those services is vital and critical as our older population is growing. Money Follows the Person is a program at the federal level that Ann mentioned that provides transitional support for these older adults that are leaving institutions so that they can live independently in community settings or in their home settings. But sometimes during these transition processes, there are minor support needs that are essential for them to live that way. Furniture, clothing, maybe some sort of basic toiletries, things like that that maybe the federal program won't cover. Also, sometimes these people are, during the transition period, are already in that stage of being moved out when they find out for whatever reason, Money Follows a Person isn't going to cover that transition. In both of these types of circumstances, the Division of Aging Services has been successful in going ahead and using these SSBG funds to go ahead and get those people moved out. That's a win-win because that allows that person to live independently and at home, and it's a win for our state budget because it takes that money, it makes less of an impact on our state funding for Medicaid and other sources. Also, when we allocate these SSBG funds to deinstitutionalize older adults, when program like the Money Follows a Person funding cannot be used, it unfortunately reduces SSBG funding for other necessary and vital support, things like homemaker services and meals and respite care, as you heard from Ann, that we actually need that money for as well. And the Division of Aging's budget for fiscal year 2014 is also facing a budget reduction for these types of direct respite services. So these SSBG funds are extremely necessary so that those living with dementia and Alzheimer's and their caregivers, we can make up some of that hole that we have right now with our budget constraints. While SSBG funding is allocated in the same way year after year, we are asking that you consider taking this opportunity to find more creative ways to use the SSBG funding without harming any of the groups you're trying to serve. With the Olmstead decision and current focus on deinstitutionalization, SSBG funding provides a flexible vehicle for supporting community services and softening the growth curve that we are facing with Medicaid. At a time when elder abuse is on the rise, additional SSBG funding could lower the Adult Protective Services caseloads without an allocation of new state funding. Georgia's APS, or Adult Protective Services caseloads, are behind national standards already. Complaint investigations are sometimes taking longer than 30 months and placing all these at-risk adults at high risk. With a heightened and welcome focus from law enforcement on bringing abuse, neglect, and especially financial exploitation cases to prosecution, we must have the infrastructure to place case investigations at an all-time top of our list, as well as guardianship for these at-risk adults. So these SSBG funds could be vital to helping us fill that hole that we have in some of our state budget right now for fiscal year 2014. Use of state funding in DBHDD waivered services rather than federal SSBG fundings is also another alternative that would allow Georgia to leverage greater Medicaid funding and free the federal funding to address needs served by the Division of Aging Services that they can't do right now. Currently, 40% of the Adult Protective Services cases have a mental health or developmental disability diagnosis as well. But the SSBG funding doesn't follow those the way that some of the Medicaid monies do when they get out into the community. We understand Georgia may be facing a reduction in SSBGB funding. We don't know what's going to happen at the federal level. The money may not be there at all. But if the money is there, we do ask that when a time when our aging population is steadily increasing and our state budget is tight for aging services, and aging services taking a large cut, that Georgia can not afford a cut in these SSBG funds if they're available. Last year, I believe Georgia was allocated around $53 million, and Division of Aging Services got about $9.5 million of that. We encourage you to maintain the level, if not increase that funding to the Division of Aging Services so that we can protect our older adults. This will enable the division to continue to provide vital and necessary services, as well as continue to deinstitutionalize our individuals and help with emerging needs as this population continues to grow. Thank you.
Our next speaker we have is Kathy Simpson from the Georgia chapter of Alzheimer's Association.
Thank you, committee members. We appreciate the opportunity to share our comments. The Alzheimer's Association represents approximately 120,000 Georgians currently diagnosed with the disease. Unfortunately, we believe those numbers are extremely low because the diagnosis of Alzheimer's is difficult and oftentimes takes years to accomplish and takes a long time for families to understand that dementia or Alzheimer's is occurring in their family member. As of 2009, only 16% of residents in Georgia's nursing homes did not have some form of dementia. 45% increase in dementia in Georgia recognized between 2000 and 2009. Right now, there are over 800,000 individuals with Alzheimer's living alone. 60% of individuals with Alzheimer's and related dementias live in homes with families, not in nursing homes. In Georgia, as well as nationally, 800,000 of those people live alone. Many of them do not have caregivers, do not have family members who can assist them or look out for them. It's an imperative that we take care of our frail elderly, particularly those with Alzheimer's and dementia. Without the support, the security network of adult protective service workers focused on the needs of the frail elderly, we are doing our seniors a disservice. Other groups in our population are important, but our seniors have laid the groundwork for us. They raised us as their children and their grandchildren. They built the society that we are now taking a part of, and we need to continue caring for them with dignity and respect with which they cared for us. We encourage the additional funding or refunding of the 17 positions with adult protective services, and we also would like to speak addressing the respite services. Caregivers for those with Alzheimer's in Georgia contributed over $221 million in higher health care cost. They take care of family members at no paid care. Unfortunately, many of them risk health issues to themselves. I am a former family caregiver for a mother and a grandmother. I developed health issues of my own as a result of the stress of caregiving for individuals with Alzheimer's. I would encourage a closer look at the health care needs of both the caregivers and the individuals with dementia. Thank you very much.
Is there anyone else who would like to speak? If so, please approach the podium and give us your name and the name of the organization you represent. Okay. I'd like to thank each of you for attending today's hearing. Now, would any member of the panel like to speak? Okay. I'd like to thank Senator Tim Golden, Representative Katie Dempsey and Sarah Dunn representing the House Budget Office, and Clay Buckaloo representing the Senate Budget and Evaluation Office. Now I'll turn it back over to Senator Tim Golden for closing.
Thank you, Demetrius. I appreciate it. Representative Dempsey, thank you for being here, and Sarah and Clay, and we appreciate everybody's participation today, and meeting is adjourned.